you got an 8-ounce cup. If you pour 12 ounces in an 8-ounce cup, you're going to get 4 ounces of spillover. So if you only have 8 pounds of muscle, you're not going to be able to hold the amount of gear that you would need for 12 pounds of muscle. So it's going to go to the skin, the hair, the prostate. It's going to get aromatized in the fat cells, turn to estrogen, etc. So the idea that people hear, oh, the pros use 2 or 3 grams. Pros have 100 to 200 pounds of muscle. You don't. How do I do stack these? I've often seen using 20 milligrams a day with 2 IU of GH generate 1,500 testosterone nanograms per deciliter in the blood with lower DHT and lower estradiol than the bullshit 100 milligrams every 3 days that everyone else does. Plus, they subjectively say their mood's more stable, they get less pimples, they get less hair loss, they get better blood pressure. People don't want to do it, and then every time someone does it, they're like, this completely changed my life. But when would you only do 1 shot a day of GH? When you don't want to succeed. When you want to do it wrong, you do 1 shot a day. Or if you're using baby doses. But if you're an adult and you're actually trying to win this shit, you're going to be using MOTS-C, BPC, TB500, GHKCU, Retatrutide, GH, Boldenone, Tren, Test, Masteron. But that's not all of them. And some of these are more than once a day. Am I getting myself 20, 30, 40 shots a day? That's absurd.
So you're a fan of high frequency?
I'm a fan of fucking shit up just the right amount and then fucking it up again 48 hours later. Optimizing for frequency. The repair process and the growth process are parallel. They're not sequenced. We used to think that you had to be done being sore before growth would occur. That's not true. Growth and repair are parallel. I will fight against evil if I have the chance. And podcasts are the only opportunity for me to fight against the evil that's the American healthcare system.
That's the Final Fantasy coming out in real life, baby. Let's go. Oh, that one's the Berserk sword.
So, well, nonetheless, Guts is full of rage right now. Sephiroth, I'm coming for you. This is the longest, most brutal diet I've ever done, and I feel nothing compared to what I would normally feel because of running. And then the energy I get from the MOTS-C and the SLU, the combination of those three, the 3 new things this prep that I've never done before. And out of 17 years of competing, this is by far the easiest prep I've ever done and the leanest I've ever been.
Do you happen to utilize any ancillaries to make sure that you're maintaining a decently sufficient level of power fit information? Before starting this podcast, I just wanted to say that ideating steroids for a full show is not widely accepted because it discounts the real work, which is the backbone of this sport. And unfortunately spreads that an unsafe chemical solution is all you need for results. Both of these are antithetical to society's understanding of the sport. And while there will always be some that claim that PEDs are all you need, I would like to deliver an honest message of what is required for achieving top performance, as well as the dangers associated with this route. I received this comment from a user named Nightscarens. But just as a rock climber, the athletes undergoing this path in the sport are willing to put their life on the line for their passion. Just the danger between the two sports is different. Luckily, we do have safety nets in the sport, such as organ imaging and regular blood work. But that doesn't change the high risk one must accept in taking on this competitive lifestyle. Now we're back to normal.
Yeah.
And we don't have any hard breathing because our cardiovascular systems are a little bit better than normal.
Yeah.
Yeah. It's that prep cardio, right?
Yeah.
That's what it is.
I didn't do cardio this morning. That might be why I was sleepy.
Yeah.
Cardio usually wakes me up.
Well, you finally drank caffeine for the first time, so I mean, close enough, right?
Because I was tired. I normally am never tired in the morning, but I was tired, so
yeah,
I wanted to be chipper.
Mm-hmm.
35 milligrams of caffeine.
How do you feel now? Do you feel chipper?
Feel alert. Feel alert. I'm in extroversion mode. Mm-hmm. Normally, if I'm introversion mode, but caffeine makes me an extrovert.
Is this extroversion mode for you?
This is extroversion mode.
Your extroversion mode is a little bit more calm.
No. Well, yes. Yeah, because usually if I'm in introversion mode, I'm so focused on getting the job done, I'm completely disregard anyone's feelings, and I'm just ultra blunt.
You are very blunt.
Yeah, but with extroversion mode, I'm more considerate and I'm more engaged with the person that I'm talking to with eye contact, and I can pick up their facial features and emotions.
That's cool.
So I'm able to tailor my communication to the audience or the individual I'm talking to.
I think Todd Lee is real life AI right now.
Yeah. Which wouldn't be artificial then. I appreciate you staying the extra day to do this. Because I'm sure you would have went out earlier.
I mean, well, you were already on your way, so I wasn't about to cancel on you, but I'll still make it in time for everything and the arrangements and the funerals and stuff. So, but I was thinking,
give Lexi my condolences.
I will. I'm sad she wasn't able to meet you today, but sometime soon for sure. It's always a coincidence. Every single time I have a podcast, an in-person podcast here, for some reason, something happens and she's not here. So, and she actually isn't a fan of that because she even got me these. I feel really blessed. She got me these cups that even say Transparent podcast on it and everything, and she's super supportive of the pod. So it's how I know it's the one.
We should have those cups.
Maybe during the break, but we're tight on time. So
we should have it written here, just like TCN.
No, that'd be dope for
Chucker Carlson Network. I was like, why do you advertise on your mic? You're on the screen. We know who we're watching.
I'd love to put a great convo that I had with Dr. Dean with a great convo that I had with you to basically determine what dosage and gear should really look like for each individual. So something I discussed with Dr. Dean was fast versus slow metabolizers, drug metabolizers, of course. And in this, I think this conversation, he's basically discussing how you have fast metabolizers, you have slow metabolizers, and people like to compare dosage on just like a milligram to milligram basis per person. So it's really easy for people to assume let's start at 300. Everyone should start at 300. Oh, everyone should start at 500. It's not the case, right? You have TRT people that are prescribed either 100 milligrams or even up to 200 milligrams. Sometimes they reach the same levels with the same side effects, etc. So fast metabolizers basically in and out of your system quicker, which basically means that normally these people end up feeling the benefits of the compound less, but also tend to feel the side effects of the compound less. Slow metabolizers is vice versa, is the opposite. And then the conversation I had with you, which I really loved because I think it was probably the first time I actually discussed this, was the saturation of androgen receptors. And you discussed why people have side effects. And you said 3 reasons. One of them was because of sporadic dosing. Second one, and sporadic dosing is such a great explanation. If you have hormone fluctuations, that's always the cause for some of the most insane side effects. And you can just see this, not even just in gear, but you just monitor a woman's menstrual cycle when their estrogen, the testosterone, progesterone, whatever, when it's all going downwards, it's not a good time. So, and then finally, you were discussing androgen receptor count and saturation. And if someone is taking, say, less gear to saturate their androgen receptors, it's less likely that they're going to feel an exacerbation of side effects. However, if they're taking compounds at a dose more than however many androgen receptors they have, which is normally correlated to how much muscle mass they have, obviously individualistic per person, then they tend to feel a little bit, they could exacerbate their side effects, right?
Yeah, basically, you got an 8-ounce cup. If you pour 12 ounces in an 8-ounce cup, you're going to get 4 ounces of spillover. So if you only have 8 pounds of muscle, you're not going to be able to hold the amount of gear that you would need for 12 pounds of muscle. So it's going to go to the skin, the hair, the prostate. It's going to get aromatized in the fat cells, turn to estrogen, etc. So the idea that people hear, oh, the pros use 2 or 3 grams, the pros have 100 to 200 pounds of muscle. You don't. So they have more receptors on those muscle cells because they have more muscle. You want the steroids to go to the muscle, not to the other organs. Now, of course, it's not something like 100% and 0% if you underdose. I mean, you're going to get a percent. Some of it's going to go to those other things, but you may not notice. It might not be clinically significant.
Right. And I think that's another discussion that I really loved with you and Dr. Dean is in the more complex scenarios when we're really diving deep into what your actual stack is. That's why kind of making up the stacks almost matters in a certain sense, because then certain compounds are competing for those receptors in a way, right? And whenever it gets to that point, it's too complicated for even me to comprehend. And I know Dr. Dean was discussing, like, you know, you kind of have to look at the molecular structure of each of these. And that's like a whole thing to just determine how many molecules are in the milligrams of each compound that you're injecting. And then how are they going to compete for this? And it's just fucking difficult to figure out, especially on a stack by stack basis. But I think that's why it's pretty valuable for us all to look at the anecdotal evidence and the empirical data of what we have, which essentially these days is unfortunately just pro bodybuilders, right? Pro bodybuilders, maybe lifestylers. I don't know. You guys, you, Steve, a bunch of other people that have experimented on themselves. So, yeah. Thank you for doing what you do, bro.
My pleasure. So I think the original question was, how do I do stack design?
Yeah.
All right. So I can get more out of 20 milligrams than some HRT clinic can get out of 100 every 3 days.
Mm-hmm.
That I can see, I've often seen using 20 milligrams a day with 2 IU of GH generate 1,500 testosterone nanograms per deciliter in the blood with lower DHT and lower estradiol than the bullshit 100 milligrams every 3 days that everyone else does. And that, to me, plus they subjectively say their mood's more stable, they get less pimples, they get less hair loss, they get better blood pressure. And it's one of those things where people don't want to do it. And then every time someone does it, they're like, this completely changed my life. And to me, it's like so stupid. Like, I don't want to give myself that many shots. I'm like, that's fucking retarded. That you're doing a GH every day. Then you're going to add 3 injections with a hypodermic syringe. That's 10 injections a week. Why not do the 7 injections you do of GH and just load the GH insulin pen with some test?
Are you sure that's okay though? Because I've heard of, I don't know, there's weird things with, well, I guess if I'm going to be totally honest, maybe mine doesn't apply because the research that I was looking into was mixing, for example, test and BPC in the same syringe, since I had someone asking about that. And I think the concerns were cross-contamination, especially with an oil versus something that's mixed in backwater. I mean, obviously these things are going to mix easily and you're not baking a cake, so you don't want to mix them. There's no point in that.
Okay,
but.
So the concern would be that you're going to draw up the water before you draw up the oil, and the water is going to contaminate the oil because bacteria grows in water faster.
Well,
you just do the oil first.
What I don't fully understand, and I'm kind of just regurgitating, to be honest, from reading this, is that I think the concern was breaking it's because the 2 compounds in concern were test and the BPC peptide. The concern was breaking the peptide to the point where it's not as functional.
Why? It doesn't make any sense to me. Why would the molecule, there's not going to be any chemical reaction that occurs between BPC and testosterone in the 8 seconds that they're in the same syringe before you inject them in your body.
Yeah. Okay.
It's not like you're just drawing it up and leaving it there for a week.
Mm-hmm.
You know, I'm not ever suggesting someone backloads.
Right.
You take the syringe, you put it in the test, you draw it up to 10 units. That's 20 milligrams.
Mm-hmm.
You take it out, you stick it in the GH, you draw it up to 10 units. Now you got 20 units.
Mm-hmm.
You got 20 milligrams of test, 20 milligrams, 2 units of GH. You stick it in your shoulder, you push the plunger down, you throw the needle in the sharps.
Mm-hmm.
You can't fuck it up. And then like, well, it's like, okay, let's say you're right. Let's say you lose 10%. Who cares? Because you're going to be able to do your blood work. You're going to see this is what my levels are. Oh, they're not high enough. I'm going to raise the dose until you get the right levels. It doesn't matter. It's not like the GH and test are that expensive that you can't afford to lose 10% of them. If you want to do 14 shots a week.
How hypothetical is the 10% though?
I think that these people are just making shit up. I literally think that like when Steve and all these people say you can't mix these things in the same syringe, they're just making it up.
Does Steve say that?
Yeah, he just said it. I didn't even watch the reel. I read the title. I'm like, yeah, I don't give a shit what he says. That it's just all made up. That there's no fucking way that they're going to have a chemical reaction in the 8 or 9 milliseconds that it's in the same syringe before you inject it in your body. And if they're peptides and you inject inside the muscle, the bloodstream carries it throughout your whole body in like 20 seconds. If you do it under the fat, in the fat, that subcutaneous nonsense, sure, it might sit there for 3 weeks. It might crystallize and cause necrosis. I have a huge hole in the skin of my lat because I missed the muscle and got under the skin. That subcutaneous crap only makes sense if you really got a huge body fat percentage. You should always inject in the muscle. The idea that, there's more of an immune response, that's fucking retarded too, because why would you have more white blood cells in your muscle than you do in the fat? The only explanation would be increased blood flow. Well, if there's increased blood flow, then it carries it out of the muscle faster.
I feel like there's a lot of merit though to just elongating the period of time that, say, like GH is taking effect. So if you're taking it before bed, for example, taking sub-Q. If you're taking IM and you want to do fasted cardio or whatever, then obviously you may take IM in the morning.
Right. So, but when would you only do 1 shot a day of GH? When you don't want to succeed. When you want to do it wrong, you do 1 shot a day. Or if you're using baby doses like 4 units or less.
Yeah, or smaller
but
doses,
if you're an adult and you're actually trying to win this shit, you're going to be using more than 4 units.
4 to 6 probably on average.
4 to 12, whatever.
Yeah, the big guys would probably be taking some crazy.
It's about matters as what
I feel
you
like
want.
it's necessary.
What you have to do to get your IGF level to max out.
Yeah.
That's what it comes down to. So I do 2 to 3 in the morning, 2 to 3 in the afternoon, and then 4 before bed. Do I do it sub-Q before bed? If it's the only thing in the syringe, but it isn't, because I don't want to give myself, if I'm doing MOTS-C, BPC, TB500, GHKCU, Retatrutide,
that was
GH,
a fun one to say, huh?
Boldenone,
Retatrutide.
Tren, Test, Masteron. That's not all of them. And some of these are more than once a day. Am I going to give myself 20, 30, 40 shots a day? That's absurd. No, you're just going to load up 1 syringe with as much shit as you can fit in it and then let her rip.
Yeah.
You're going to run out of injection sites in 1 day if you did it their way. These scientists that have no science degree, that just have a YouTube channel, they don't know what the fuck they're talking about because they don't walk the walk. So they have no common sense. They have no idea what they're doing because they don't do it. It's all like, well, this study said in these rats, we lost 11% efficacy when we mixed these 2 drugs together in the same syringe. And they didn't do that. There's no fucking way they did that. This is just made up shit.
I'll be honest, I hate being on the other side of this right now because there are some shots being fired.
It's like, but you don't pretend to be an expert. You know what I mean?
I mean, I don't pretend to be an expert, but if I'm going to be real, like I always take everything I hear with a level of speculation, but I also trust that most of you guys, if not all of you guys, know more than I do. So,
Which
I guess I just
true.
listen to what you say and then I do my own research and then I that's just how I do things.
All right. So not you, but let's say my name's John and I flip burgers. All right. And I'm watching the internet and you've got 3 bald priests, 4 bald priests, 5 bald priests saying one thing. And then you got Dr. Todd Lee saying something else. Then with the sheep mindset is, well, these 5 bald priests are all saying the same thing. And this one dude saying something different, he's probably wrong. And that's the mindset of someone who's going to be flipping burgers their whole life.
I guess for me to be specific about this particular topic right now, I haven't seen the real, so I haven't seen exactly what they say about compounds, but what I've seen from my own research is there are some things that can be mixed, and then there are some things that probably shouldn't be mixed. So one example is like the GLPs. You should not pull them with other things into a single syringe.
Why?
Right. GLPs specifically, but if there's like BPC or TB500, there's like why is there any problems? There shouldn't be any issues. There's I think there's a lot of things that probably raise no flags. If I'm going to be honest with you, I'd literally have to type it and look up what I was looking at for the reason why GLPs can't be mixed, but apparently those are just the ones that can't.
Okay, but can and can't's light switch thinking. Nothing in nature is light switch. It's not like it you pull it up with something, it disintegrates and it doesn't work at all, versus it works 100%. What if it degrades 1% per minute that it's in the same syringe? Then I don't give a shit. I'll just use more GLP until I get the desired result. But I got shit to do. I'm not going to be fucking drawing up 30 syringes a day for every drug, multiple shots a day. You know what I'm saying? So when we got in this conversation with HRT population, we're talking about low sophisticated. We got Joe the burger flipper, right? Joe the burger flipper, he wants to do 2 shots a week because it's easy, not because it's effective. So the idea that doing 1 shot every day is less effective because you're mixing the stuff in the syringe is a fallacy when you compare it to doing 2 shots a week and just not using any other drugs. Because if you're going to not mix things in the syringe, he just wouldn't use the GH at all. Or he just wouldn't do daily injections at all. So to get someone who doesn't want to do daily injections to do daily injections is a big deal because most people are pussies and they don't want to stab themselves. So if you get them to do it once a day,
so many shots.
If you get it once a day, that's a big win for you as a clinician. None of these fuckhead scientists have ever actually treated patients. They don't know how hard it is to get these stubborn assholes to do what you tell them to do. So if you can get them to do 1 shot a day, that's a fucking win. You're going to try to get them to do 2 shots a day, 3 shots a day, 4 shots a day, 8 shots a day, because it's 1% less effective. 8 shots a day is 1% more effective than 1 shot a day. No way. They're not going to do that. No one would do that. Even if it was 20%, they're like, doc, I'd rather pay an extra $200 a month, buy more drugs, and do 1 shot and have them be slightly less effective, and we'll just turn up the drugs. Not everyone's broke. Some people have the money. They just don't want to do painful shit. Now, if someone's like, I literally have $200 a month to pay for food. It's like, okay, well, we're going to use the dead minimum amount of shit to get the job done that you need. And in that case, we're going to treat everything like it's liquid gold. But if someone's making $1 million a month, they don't give a fuck if they're using 2 units of Retatrutide, 2 milligrams of Retatrutide twice a week, or 3 milligrams of Retatrutide twice a week. They could afford 100 milligrams of Retatrutide 3 times a week. So if they just want to do 1 shot a day max, load that fucker up with as much shit as you can fit in it. And so this is they say I don't have nuance. It's like the nuance is over the heads of the real. You know, nobody watches YouTube. No one watches a 50-minute YouTube video usually, unless it's a podcast. So they're not going to watch a 50-minute instructional video on how to use Retatrutide. They will watch a 90-second reel on Retatrutide. So I've got 90 seconds to say everything they need to know about Retatrutide. So one of those things is not going to be, there is an 8.2% degradation at a rate of 1 per every 30 minutes that it's mixed in solution with this list of drugs versus this list of drugs. No one's going to remember any of that. If I do a video that says, Masteron's awesome, Primo's stupid, don't use Primo. There in the comments, the questions are, what do you think about Primo? That's the level of intelligence of about 30% of the audience.
I mean, I wouldn't call it intelligence. I just call it people's attention spans these days.
But
like most people don't want to take the time.
It's a 90-second reel. You know, I mean, if they can't focus for 90 seconds, to me, that's retarded.
I know, but it's just like you have to consider what's going on in people's lives, and some people just don't care. You know what I mean? And it's annoying. It gets irritating, but it's just how it is.
So I guess it just depends on how we determine intelligence. I look at intelligence as the output, not a contributing factor in the input. So if someone's latent IQ plus their attention span, plus their discipline, plus their ability to focus, plus their working memory, plus their long-term memory. And then all of those factors, if we got 0.8 times 0.7 times 0.5 times 0.3, we're looking at like 20%. So to me, that person's retarded because they're operating at 20%.
Okay.
Yeah, I know it's brutal.
It's so brutal, bro.
This is Todd on caffeine. This is extroverted Todd. This is the polite one.
This is the polite one.
This is
That's
polite
crazy, one. Bro. I'm not even sure how we got to
because you were talking about
syringe, to be honest.
The whole idea of doing, I think it was daily injections. And that
Okay.
my whole point is the people don't want to do daily injections because they don't want to do 10 shots a week. They don't want to do the 3 hypodermic needles and the 7 insulin needles. I'm like, just do the 7 insulin needles and load the insulin needle up with the GH and the test.
What are your thoughts on resulting scar tissue from doing small daily injections with the insulin pen versus doing big injections, say twice a week with obviously a bigger pen?
Well, it's of course going to be more scar tissue with a harpoon 3 times a week than a little baby insulin needle 7 times a week.
Like you can say that with a high level of confidence.
Yeah, like this delt, I don't know if you can see the striations in it right now, but
I can see the striations.
Yeah, so they say, oh, if you inject your delt, you don't get striations, blah, blah, blah. I probably done this delt 10,000 times. If I do 5 shots a day in this delt for 365 days a year for 4 years, what's that come out to be? 1,400 times 5? So that's going to be 7,000. I've done 7,000 injections probably in this delt with insulin needles. Looks striated to me. So if it looks good on stage, who gives a fuck if there's scar tissue or not? Mm-hmm. The scar tissue goes a whole 1/2 inch deep. The muscle's 2 or 3 inches deep. Doesn't get in the way of contraction. Now, if I instead shot a 3 milliliter bolus of oil in the middle, you've got this ball that the muscle fibers have to wrap around. It's not going to contract right.
Okay. Gotcha. Makes me feel better about my daily injections.
Oh, fuck yeah, dude.
But I mean, if I'm just going to say something to defend daily injections, it is very easy to just do with a small insulin pen. So, yeah. And even if you're like on prep, normally I feel like the liquid's like a milliliter a day, which imagine putting that into like 2 injections. That just doesn't sound very appetizing.
Well, okay, let's say you're in prep or you're open pro and you're doing 3 grams a week. That means you're doing about 400 milligrams a day. You're going to have to use 2 insulin syringes. It might be, in that case, better to use a hypodermic with a 27 gauge needle and put 1.5 or 2 in one spot, like the glutes. But it really isn't, because the surface area to volume ratio of the bolus is so poor. You're better off with 2 1 milliliter boluses than 1 2 milliliter bolus, because you're going to absorb it probably twice as fast or 3 times as fast. Because of the surface area to volume ratio of a 1 milliliter droplet is much better surface area to volume ratio than a 2 milliliter droplet.
Gotcha. Okay.
For example, they did 3 milliliters in the glute and it was 78% absorption, area under the curve. They did 1 milliliter in the glute, it was 78%. They did 3 milliliters in the glute, it was 56%.
Gotcha.
So you lose. Now, is that real? I don't know, because where the fuck did it go? It just disintegrated? That doesn't make any sense. But I think it was within a given window of time.
Yeah.
So you absorb much
sense.
faster from the 3 1 milliliter boluses than you would from 1 3 milliliter bolus. In which case, if you're doing multiple shots, then the biggest bolus you're ever going to do is a milliliter. Again, we return to the 27 gauge insulin syringe. And if you're in prep and you can't reach the muscle through your fat, you shouldn't be on prep.
No, that'd be insane.
You should be starting prep at like 12% body fat, tops. Like I would say.
What? I don't know if I agree with that.
I do. Like 20, if you're like 12% body fat and you have to get down to 9% body fat, you have to lose you get 3% body fat. If you're 12%, you have to get down to 3. You've got 9% to lose. You're 200 pounds, you're going to have 18 pounds to lose. You should not be trying to lose more than 18 pounds of fat in prep, because you're going to lose some water with that too. So 18 pounds of fat, you're going to lose
actual fat.
30 pounds of water. If you're going to try to lose more than 30 pounds to get on stage, you're too fat to start prep.
I mean, obviously this differs with height and just how big you are in general, or varies a lot. But I agree with just like I agree it's not optimal to do something like, for example, Larry Wheels, who had to drop from, say, like 290 pounds to, I think it was maybe 240 or less for his first classic show he was doing in NPC. And I think this was last year, a year and a half ago or something. But the whole 12% thing, though, I think, from my knowledge, it varies per person, but it's normally optimal for someone to stop their bulk around 15 to 20%, maybe preferably 15.
I'm agreeing with that.
Okay.
What I'm saying, prep is different from pre-prep.
Like the whole prep cycle protocol.
Right.
Et
So
cetera. Okay,
I would
sense.
say you get up to 15%, your off season's over. Then you do a health maintenance washout phase maybe. And then you could do a mini cut.
Gotcha.
And start ramping your dose back up.
Okay.
You maybe lose 8 to 12 weeks of a mini cut, get yourself from 15 down to 10%. Then you do maybe 3 to 4 weeks of a diet break where you're eating maintenance and you give your body a rest. And then now that your drugs are high and you're at 10%, now we start real prep.
Gotcha.
Where your calories are only coming down 500, but you're using cardio and diet drugs to help you be efficient, so that in theory, because you're starting prep at 10% and you're doing 20 weeks, it's so mild and you're using all the diet drugs, like whether it's Clen, Tren, SLU, whatever. I'm not saying you do 20 weeks of Tren. I'm just saying there's so many diet drugs. You can, every couple weeks, you introduce a baby dose of a new drug, like playing a card, like, oh, here's an ace. Like, oh, I won that hand. And then when you save them. So the point is that now you don't use drugs in a money cut. You don't use drugs in a maintenance phase. Not really. You use the mini cut to ramp up on your normal anabolics. Then you have a diet break where you leave the anabolics in, you get your calories to neutrality, you maintain at 10%. And then after about 3 or 4 weeks at 10%, now we start prep. And we are like, we're going to start adding in cardio until we can't add any more cardio. We're going to pull away carbs and fat until you're too hungry. Then you're going to add Retatrutide to control the hunger. And then you're going to add in stuff like Clen, SLU, Wrath, whatever, to help you get into prep so that you never really feel like you're on prep because you started so lean and it's such an easy prep.
Okay. That makes, I can get with that mindset. It's, I think it's the way you use the verbiage sometimes that gets me, but I know where you're coming from. And my coaches too have always, all the coaches I've worked with have always had the same thing where that beginning part, like I like to do a long prep, but obviously in that beginning stages, those first several weeks, the compound uses basically the same compounds as used during the bulk. It's basically the same base. And it's what I'm doing right now too. So I'm 11 weeks out, but still no diet drugs, no orals, no things that aren't out of the ordinary, except for, I guess, the normal base that I have, except for the fact that my coach's choice for this prep, he was switched the Primo with DHB, essentially. Good. So
what did your GGT come back? How much DHB and what was your GGT like?
I haven't gotten, it's only been a little over a month or something. So I haven't gotten the blood work yet on cycle, but DHB is 300.
So you're using 45 a day?
Is that the math right? Is that
45 a day would be 315.
Huh?
45 a day would be 315. 40 a day would be 280.
Okay. Yeah, something like that.
Okay.
I just divided it by 7 and then
you backloading?
No. I just divided my dosage by 7 and then equated it to how many milliliters I'm pulling with the density.
Well, in that case, you're using 43 a day.
Okay, bro's fast at math, man. I need to go back to school. I failed my no, I didn't fail it, but basically now if I went back to engineering again, I'd be considered a failure for sure.
I can't rough, man. Math is just, I don't know, math's like breathing. You just let the answer come. I think people overthink it.
Yeah.
Yeah.
Well, I can tell you the muscle has not been worked for like a good 10 years or something, so.
Oh, okay.
I've been using a little bit different muscles this time. Regarding the dosing, what would be the best for people to aim for? Because I think I have a wide range of people in my audience, and I think it's kind of just cool to discuss everything from every standpoint. And I think it would be cool and valuable for us to list all the reasons why dosing too high isn't good and why dosing too low isn't optimal. Mm-hmm. So
I talked about you can usually get up to a 1,500 test with as little as 20 milligrams of test a day. That's where, I mean, if you can get up there, that's good enough for me. And then I try to
1,500 like nanograms per deciliter of total test. How can people do that? Because most people don't reach that level with 140.
Almost everyone I treat does.
How?
Because they're doing the daily injections with the GH. So the GH upregulates the androgen receptor, and the androgens upregulate the GH receptor.
Okay. And
then the estrogens, usually I keep it high enough to we're getting a lot of IGF-1 conversion. So I want to have them at least at 1,500 ng per DL test, and I want them at least 300 IGF-1.
On average, what estrogen and GH do you normally have them at?
Probably 40 to 50 estrogen and probably like 2 IU of GH.
Okay.
As little as that much, 20 milligrams a day of test and 2 IU of GH will get them to 1,500. With 71 DHT, 70 DHT, 1,500 test, 40 estradiol, 300 IGF-1. To me, that's you've graduated first grade and you're now ready for anabolics. There's no reason to use more of that shit if you're there.
Do you find any of them have any issues with, I guess, their estrogen that high at 40?
No, because it's divide 1,500 by 40. It's almost a 40 to 1 ratio. It's like 37.5 to 1 or something like that.
What about individuals that just tend to be more prone to gynecomastia?
If they're that overweight, they shouldn't be using steroids. They should be on a fat loss diet. So I would basically, in that case, run them lower on test, run them high, replace it with Masteron.
Like, what do you mean replace it with Masteron?
So if I would run 10 milligrams of test a day and 10 milligrams of Masteron a day, then they would get half the estrogen. Same anabolic load.
Okay.
Yeah. Now, if somebody wanted, if we're talking about like you want to get some muscle and you're not growing, which is never the case. Everybody who does the training I give them and the diet I give them, and even on that little ass doses of test and GH, they will grow and up until their genetic limit. Once they hit their genetic limit, now 10 milligrams of DHB a day is usually enough to push them beyond that for a while, 6 months to a year. Then 20 milligrams of DHB a day. By that point, if their liver's handling it, they could go up to 30. But if their liver's not handling it, then that's when we introduce Masteron. Because DHB is 3 times more anabolic than Masteron or test. Masteron and test are about equal. DHB is a whole league of its own.
Yeah. Mm-hmm.
Trend's above DHB, but Trend comes with a myriad of side effects. DHB's only side effects is just liver.
Mm-hmm.
Whereas Masteron and Anavar, their side effects tend to be cholesterol.
Gotcha. Cool. Yeah, bro started me at like the highest of the normal standard dose, like off the bat, which was fun.
You're with Pitor?
Yeah.
Okay.
Yeah. I hope this is okay that I'm talking about this, man.
He's in Italy. Doesn't matter.
I fucking love him, bro. He's such a good coach. But especially when it comes to like the client coach relationship, you know what I mean? But
it takes 6 weeks to hit steady state concentration with DHB anyway. So even
it takes how many weeks?
6.
Mm-hmm.
DHB is slower. So, you go get your GGT done and maybe ferritin and watch my podcast with Dean where he talks about the other ways of determining liver damage with ferritin and whatnot. It's pretty technical.
Cool.
But I just usually, up until that conversation with Dean, I just check the GGT.
Okay.
And then if your GGT is high, you can stay on the DHB if you blast glutathione.
Yeah.
Now, he would say that's a Band-Aid, but you're not going to be on DHB for that much longer anyway.
Mm-hmm. Real quick, guys. So while I was looking at the YouTube analytics, I actually saw that 85% of you guys that watch this channel are not subscribed. And I want to ask very little of you guys, but if you enjoy this podcast, if you find value in it, then please do me this one favor and subscribe to the channel, because doing so helps me get bigger and greater guests like the guests you are listening to today. Also, this channel is not sponsored, which means only the companies that I work with, which are Young LA and Huge Supplements, are the companies that can help fund this channel by you guys using the code NILE. So code NILE gives you a discount of 15% off of Young LA, and code NILE also gives you a discount of 10% off of Huge Supplements. And if you decide to purchase anything from any of these companies, it will help immensely for me by using my code. And this way, I can travel to other guests and also upgrade in equipment to make this podcast bigger and better for you guys. Cool. All right. I actually really want to listen to that conversation. That sounds really dope. Okay, so as far as like just something that I think I want to say. So I think from the conversations that you and Dean have had with me, I think it's safe to tell people this is why it's kind of very difficult for you to assume that somebody is maybe lying about their dose, or someone should be running it higher, or someone should be running it lower. You kind of just don't know how they respond, right? This is something you have to figure out for yourself. Mm-hmm. It's like playing a game of darts and then seeing the result and then going back to the draw board over again. And I'd say, just in my opinion, why running doses just too low isn't optimal. I mean, it's good to start off if you're just beginning, right? And then you titrate it up slowly. So then that way you can see where you're landing. Mm-hmm. But if you've been running it low for so long, obviously you could be maximizing your potential by running a higher amount of dose. But
maybe, because let's say you start pushing it out of the green and into the yellow, then your body's going to start fighting back. You're going to have long-term inflammation, and eventually you'll have to come off. But if you keep it in the green, you can stay there forever. Yeah. So it's the tortoise, not the hare. The whole idea of cycling is drug addict thinking. That you're going to do, I'm going to blast for 12 weeks, then I'm going to let my organs rest for 4 weeks. And I'm going to blast for 12 weeks and let my organs rest for 4 weeks.
Why not just try to maintain good organ health the entire time?
Run it half as much as you would in a blast and stay there for years. As long as the blood works fine, you're fine. Yeah. People think, well, that's just not healthy. I'm like, why the fuck isn't it? I don't know. I saw it on the internet. And it's like, well, by who? A bald priest? Yeah. And it's like, I don't give a fuck what they say.
Right. Doing it blindly is what normally tends to be unhealthy. Right. And it's normally like, I'm not trying to put anyone on blast, but you and I know specific people that have gone through this and probably passed away. People who purposely just did not want to do their scans, didn't want to do their blood work. They just avoided it. And if you ask them personally, they would still just avoid it.
But also those same people, they ain't coming to me and having me read their blood work. They're going to some fat fuck primary care doctor that takes insurance. And then that guy's like, yeah, you're going to die. You got to quit steroids. So then they just don't go.
Yeah.
So like, and the way you know a doctor sucks is he takes insurance. What? Because let me ask you this.
What?
Let's say you wanted to get someone to build you a deck. And one guy's like, I'll work for 30% of what I charge. Would that person be the one you want to hire? With the one with self-esteem so low that he only takes 30 cents on the dollar? What about 8 cents on the dollar? That's what insurance pays. Insurance pays 30 to 8 cents on the dollar. That's why the bills are so high. They're billing people $300 because they're only going to get 100 to 80, maybe even $24. They suck at their jobs. Because by working for an insurance company, the insurance company feeds you patients. They don't have the ability to actually be worth word of mouth. They don't have the ability to actually get on a podcast and talk about what they're doing and actually pull in their own business. They're just some slub who basically sits by a trough and waits for slop to get poured in their trough and they gobble it up. So that's how the normal healthcare system is set up. And then the way that people get insurance is because the medication and the doctor bills are so high, you can't survive without the insurance. So everyone buys it out of fear of something going to happen. And then the insurance company just doesn't even pay. And you just get stuck with these bills that are 3 times what they would have been. If people just hired a good doctor and negotiated a price and paid the doctor, and then he does his job, they'd be healthy. They'd pay less money than they would to the insurance companies. The whole system's corrupt, and the doctors suck ass that work in it.
I would say my little devil's advocate position to that is I would say that it's very likely that probably is true for most. And I definitely wouldn't be surprised if it was. But there are rare occurrences where you can find a doctor, and it's not easy because no one, but I, for example, was able to find a good doctor that, gets what I'm doing.
Okay, cool.
He's had dudes that have taken gear, and it's like he and I can come to a discussion about these things. Kind of just
That's
like
awesome.
On the podcast, which is cool.
Is he younger than 40?
Yes.
That's probably why.
It's probably why.
So people have this idea that the older the doctor is, the better they are. It's like, fuck no. That the medicine changes, and those fuckers are stuck in the past. The boomer doctors, they're not worth their weight in shit. You got to go with someone who's brand new and open-minded enough who can actually use ChatGPT and look shit up. There's the ones who just, well, this is what I've always done, so this is what I'm going to do. You don't want to deal with that fucking Mr. Magoo piece of shit. Mm-hmm. They suck. They don't know a goddamn thing about anabolics. It's the most obscure black magic shit in the universe to them. That might as well be demonology. So it's no way. The only way you have a chance with a young doctor who's working at a hospital is if he lifts himself and he's using gear. That would be the only chance. Or, otherwise they're going to be like, what's nandrolone? Is that like testosterone? It's like, I'm done. Do what I say or I'm leaving. It's like, yeah. So the whole thing about they don't want to go get their blood work done because the fuckers don't know how to order the blood work. They order what the insurance companies pay for. And they pay for a CBC, a CMP, maybe a lipid panel. They don't order a GGT for the liver. They don't order a cystatin C for the kidney. The nephrologists don't even know what the fuck a cystatin C is. They don't order an ApoB for cholesterol. So they're not actually looking at the lethal components. They just order the shit that the insurance company covers. And then they tell you, oh, this is high, stop using steroids. Because they don't give a fuck about you. Mm-hmm. You're just one out of 100 people they got to see that day. So the faster they can, it's called treat them and street them. It's you get them in the door, you get them happy, you give them antibiotics or something so they think that they got something for their copay, and then you send them packing. That's why all these kids are put on antibiotics when they've got a viral infection. Antibiotics don't treat viral infections, but these doctors don't give a fuck about the patient. So they give them something that's going to wipe out their intestinal flora and give them autoimmune disorders because they have nothing to protect against infections. And they've been doing it for 100 years and they're going to keep doing it. They're not going to stop with antibiotics for viral infections.
I don't want to directly blame the doctors because I know there's a lot of good doctors out there, and I know while it may be a little more rare, the older the generation of the doctor, for them to be open-minded with some of these things. But I feel like it's a little bit more of just the medical system in general and what's being taught.
But a system's made up of people. So if you're part of an evil, corrupt organization, that makes you evil and corrupt. So let me put it this way. You got a bunch of Nazis, and they've got to go take some people out to a field and shoot them.
Right now.
Yeah, right? It's like, well, I'm just doing what the other Nazis are doing. I'm like, you're shooting innocent people in the back of the head. Mm-hmm. And it's like, yeah, but it's my job. I'm just following orders. Mm-hmm. That's how doctors are. Mm-hmm. They just do whatever the American Medical Association tells them to do. And then their hands are clean of the blood, even though the third leading cause of death in America are doctors. It's heart disease, cancer, iatrogenic causes. Iatrogenic is doctor talk for whoops, we fucked up. So the third leading cause of death is doctors misdiagnosing and overprescribing lethal medications. So to me, the whole system's corrupt, but yes, it's the system, not the doctor, but they're part of the organization. It's like, I didn't shoot anybody in the Hitler's Youth, but I made the bullets. Well, you made the bullets that were going to be used. So it's like the movie Lord of War with Nicolas Cage. He didn't kill anybody. He just supplied both sides of the conflict with ammunition. But every single person killed with a bullet he sold is still dead nonetheless. So every single person who's part of that organization is responsible for the blood on his hands. The only way to fight against it is to actually go out there, learn medicine, and treat people like they're people and try to keep them healthy, not manage disease. In medical school, we're taught you should never try to heal anybody. You should just manage their disease. The hospital makes more money if the sicker they are, the longer. That in medical ethics, we were taught, number 1, don't get sued. Number 2, don't get sued. Number 3, don't get sued.
Oh my God.
And then number 4, if it's convenient, help somebody. I'm not exaggerating.
It's unfortunate because I feel this when I talk to some doctors. Obviously, there's some guys like you, there's some guys like Dean. You guys are just open about everything, but I've definitely talked to doctors that are just like, they almost can't even say anything just from fear of getting sued or just from fear of losing their license. So it's difficult. So there was surgery, supraspinatus repair. It's a rotator cuff, supraspinatus. And one doctor who is the head of sports medicine at one of the largest hospitals, I'm shadowing with her and I'm working on these cases with her, right? And she cuts the bicep tendon on every case and doesn't reattach it.
She's like, they don't need the bicep for anything. They can supinate their arm with their supinator. They can flex their arm with their brachialis. And I was like, but why not reattach it? She's like, because I could do 5 cases a day if I don't reattach it, but only 4 cases a day if I do reattach it. So it's $5,000 a day for me. This is real life. People think that I'm hyperbolic. I'm not fucking hyperbolic. I'm not a rebel. I'm not interested in tearing down organizations just to tear them down. I will fight against evil if I have the chance. And podcasts are the only opportunity for me to fight against the evil that's the American healthcare system.
That's the Final Fantasy coming out in real life, baby. Let's go. Oh, that was the Berserk sword.
Oh, you're right. Fuck. Well, nonetheless, Guts is full of rage right now.
Oh, nice.
There you go.
Yes. It's the baby.
Sephiroth. I'm coming for you.
I unfortunately broke the lights off at a rave.
Limit break. So you get a Freet in here, and you got Bahamut in there.
As far as I like the I really like the analogy that you gave about staying in the green. And I think I didn't really describe properly exactly what I was thinking when I was saying why staying too low isn't optimal. If your progress is stalling and you're doing everything right, that's your sign.
Right. So now I'll go through that algorithm.
Okay.
It's a big algorithm and it's almost never right. Are you sleeping 8 hours a day? 1. If not, sleep 8 hours a day. If you can't, give up. Grow the fuck up, make it happen.
10 hours.
And then number 2, are you lifting right? Are you super sore? Are you never sore? If you're slightly sore after body part X for 12 to 24 hours, but you're fully recovered in 48 hours, you can hit it a second time. So you can hit every body part 3 times a week. You're doing good.
So you're a fan of high frequency.
I'm a fan of fucking shit up just the right amount and then fucking it up again 48 hours later.
Okay.
That's what I'm a fan of.
All right.
Yeah, because it's optimizing for frequency.
Okay.
And then, you use enough volume to get the job done. And so if 8 sets is perfect, 9 sets is slightly sore. So if you're not 9 sets, you don't know if you're slightly sore. You don't know if you overdid it. So maybe 8 was perfect. But if you did 8 and you're not sore at all, then maybe 10 would be perfect.
Yeah.
Maybe you would never know.
Right.
So going a little bit overboard, since according to Ella, scientific snitch, the repair process and the growth process are parallel. They're not sequenced. We used to think that you had to be done being sore before growth would occur. That's not true. Growth and repair are parallel. But any repair at all is bad. So you want to have minimal inflammation. But if you have no inflammation, you don't know that you even did enough. So I like to be slightly sore. So if 8's perfect, then I want to be 9 sets. So X plus 1 sets where X is the perfect amount of sets. And I will always recover from X plus 1 in 48 hours and be adapted as well. So that would be optimal. Okay, so if you're doing the sleep, you're doing training, 3rd would be food. Are you at least maintaining your body weight? If you're at least maintaining your body weight, you're eating enough to grow. People are like, oh, you got to be in a surplus. It's like, we can argue about that till we're blue in the face, but muscle grows so fucking slow. If you were trying to gain a pound a week, then it's almost all fat. There's no way you're gaining 4 pounds of muscle a month. There's no way you're gaining 2 pounds of muscle a month unless you're like 12. Yeah, if you're an adult man, you've been lifting for 10 or 20 years, you're looking at gaining maybe 2 or 3 pounds of muscle a year. So you can forget about it. It's like you gain 1 pound a month, that's plenty. That would be exactly 100 calorie surplus. So if 3,700 calories is perfect, you eat 3,800 calories because you want to gain a little bit of fat for the security of knowing you're doing everything you can. Eating 4,000, 4,500 is not going to help. You've already maximized your return. Helms did some studies on this. Well, that wasn't on gear and steroids. For most of us, we have to use gear and steroids just to break even. So it's like that. It's not the be all end all. Then we get to the last step is, okay, our volume and frequency and intensity are fine. Our sleep is fine. Our calories are at least maintenance. Now, if we're still not getting stronger, we're not adapting, and we're not stale, then we could add in 10 milligrams to 20 milligrams of gear a day. So maybe 10 milligrams of boldenone a day or 20 milligrams of Masteron a day. That's it. You don't have to use more than that. That little bump is a big change. That would be like adding in 1 set per body part per week. And that way you can keep titrating up for months, maybe years, and your body will never notice. Your body's never going to be like, oh, today we're going to have bad cholesterol. No, it's like if we're eating perfect and you're sleeping and you're training right and your ApoB is a 70, going up 10 milligrams or 20 milligrams a year every month or every 3 months, that is not going to make your ApoB jump up to 134. But there's people I know who like, I'm going to add in a new drug and they add in 400 a week or 300 a week out of the blue. It's like, that's going to fuck you up unless you're like young. And then a lot of these guys, they learn how to do it when they were young. So they keep doing what worked when they were young. And it's like, that's not going to keep working, man. You got to be more conservative. It's just like rep ranges. A lot of guys are like, I can't lift anymore because my knees and my lower back and my elbows hurt. I'm like, well, you started doing power building when you were 14 with 6 reps and you're 42 and you're still doing power building with 6 reps. That's why your shit's all fucked up. Your minimum reps should go up by like 2 every 5 to 10 years. So by the time you're in your 40s, you should never be doing single digit sets. Every set should be 12 or something or higher reps.
Gotcha.
Because people don't look this, the weight you could do for 6 reps when you're 18, you can do for 15 to 20 when you're 40. It's not like because you're stronger, you're more durable. People are like, oh, you get more brittle as you get older. It's like, no, you stay the same level of brittleness. You're just way stronger. You're using more weight at the same amount or more reps for 5-6 times the volume per week.
I was with you until you said you don't get more brittle as you get older, though.
You might get more brittle as you get older to an extent, but not the amount that people think.
Okay.
Like between 20 and 40, there's probably not that much brittleness, but it is a fuck ton of strength increase.
Okay.
So let's say when I was 30, I could do a 1 rep max squat of 315. And then by the time I'm 42, I'm doing 500 for 8. That's a huge difference. That's a huge difference.
I think everyone, by the way, I'm sure you guys already know, but we're definitely making the assumption that you're a bodybuilder that's continuing to gain, because I think there's a lot of people that just don't, you know?
Well, everyone thinks that once you turn 40, you can't grow anymore. And it's because Fuad says so on his podcast.
Are you sure he says?
He said that your quads don't grow anymore after 40. And then Brandon Curry's like, hold my troponin shake.
How long ago was this?
3-4 years ago.
Okay.
I'm sure he might have changed his mind.
Yeah, I think so.
But here's the thing about the internet.
All the time too.
But here's the thing about the internet. Motherfuckers don't care about when you said it. They watch shit I did 3 years ago, and you're like, you contradict yourself. You say this in this video and this, and it's like, that's a 4-year-old video.
Those people are stupid, though, to be honest.
And then they're like, oh,
yeah.
And they're like, I guess that's why you think people are stupid. I'm like, yeah. It's like, look at the year that the video came out. So I don't really pay that close of attention. It's like, so it isn't worth your time to pay attention to it, but it's worth my time to answer your question about something you didn't pay attention to. Like, that doesn't make sense to me. If you're going to reach out to someone and contradict them or accuse them of being fallible, at least get your facts straight. Like, that's something I just don't do. I don't reach out to people. I don't reach out to Joe Rogan or Tucker Carlson or even someone who's small like Leonardo Joni and try to fact check them. And if I don't agree with them, I'm just like, you know what? They got better shit to do than talk to me.
So since we were talking about scans, blood work just recently, I guess, do you utilize or do you ever recommend for example, to your clients or to others, what specifically to utilize in terms of scans?
I've got my own blood
reading
work
of
panel.
blood work. You have your own blood work panel.
Yeah, and
Okay, right.
mnmlabs.com. It's called Dr. Lee's blood work.
Okay.
And there's a standard panel, there's a dialing it in panel, and there's a contest prep panel. So the dialing it in is simple. It's like once we've got you on some stuff, every month you want to fine tune your cycle. We run test, DHT, estradiol, IGF1. And I do that until I can fine tune the exact amount of GH and tests that they should be taking. Once I maximize that, that's when anabolics get introduced. It usually takes a couple months to dial someone in just right. The mid-prep cycle, they're supposed to do that every week, and it gets their estradiol and their free T3 tested. So as soon as the carb cycling starts to fail, and I see what their T3 starts going below 3, that's when T3 would be introduced. And during prep, we want to slowly titrate down on estradiol. I probably would introduce EQ in 15 milligrams a day in increments. For example, I had a 55 after I did my DHB experiment to prove that DHB was not an AI, and it wasn't. At 10 milligrams steady state,
can it act as a very, 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 very benign but like mild AI though?
What I found was at 10 milligrams every day at steady state, it was 55 estradiol. At 30 milligrams, this is ultra sensitive. At 30 milligrams steady state, it was a 55 estradiol. So it had absolutely no effect on my estradiol. Added in 30 milligrams of EQ. Within a couple days, it knocked it down to 14. So EQ is my favorite AI. And a quarter of the EQ gets converted to DHB anyway, making EQ probably one of the best drugs on prep. If you're bald and because you already lost all your hair, then I could see someone running like a ton of tests and running some EQ to control the estrogen of the test, because you don't care if the DHT goes up because you've already lost your hair. Then you get the benefits of the DHB from the EQ.
Yeah.
But it never would someone ever use Primo because there's always EQ. EQ is always better than Primo in any situation. I guess some people are like, well, what about red blood cells? It's like EQ, Primo will raise that too. You know, some individual.
Do you feel like that's not, do you not feel like that's a little bit of a subjective thing to say though?
I mean, yeah, there could be an individual somewhere, like 1 out of 1 million people where they have dramatic red blood cell changes on EQ and they do not have dramatic red blood cell changes on Primo, but they could be that person that gets a higher HDL and Anavar, but Anavar pretty much murders HDL in everyone. So it's like, I'm not going to ever entertain outliers when I discuss a subject. That makes no sense. There's 2-headed snakes. That doesn't mean snakes have 2 heads.
Or maybe someone who wants to be more or needs to be more cautious with their kidneys.
I know, but I'm not convinced that there's really that much damage from EQ to kidneys. I've used plenty of EQ. My cystatin C never went up.
Okay. I guess I'd be interested to hear if anyone in the audience has issues, like significant issues with their kidneys on EQ.
But how do they determine this? Usually when you ask people this, like, yeah, I used EQ, my kidneys suck. It's like, okay, like, what is the data that you have to prove this? I don't know. I had a high creatinine. It's like, that does not mean anything. That's just muscle. So like, that's why I don't have any value at all for anecdotal evidence. It's different if it's a prospective case study where you take someone's blood work, then you put them on a drug, then a month later you get blood work done and you see changes on the blood work, and then you remove the drug and a month later the changes went back to the way they were before,
right? And
there was no other changes. That's valid. But in the comment section, nobody ever has any valid information. They have no data. It's some subjective thing like, I added this in and I felt this way. Like, for instance, I had some guy tell me, like, I added GH in and my ankles got really swollen. I got hypo. I'm like, okay, there's no way the GH is going to make you go hypo. Oh, well, I did. And so he pulled the GH. Then a month later, I'm like, why are you not on GH? He's like, because I took the GH and I got really hypo the next morning. But I also took Retatrutide the night before. So he missed the fucking point.
Yeah.
He took 2 drugs and just arbitrarily decided one of those 2 drugs was the culprit of the symptom, the one that made absolutely no sense, the one that makes more blood sugar go up in some people. And he completely overlooked the one that was directly affecting how the pancreas works.
Yeah.
And so you couldn't have been a worse historian. You couldn't possibly have misinterpreted your own data worse. And so therefore, I can't trust anything that person ever says to me again. And that's not below average intelligence. He's above average intelligence.
You think so?
Yeah, I know him. He's been with me for 3 years. The guy's smart as shit. Just as like in Dungeons and Dragons terms, he has like probably a 14 to 15 intelligence and maybe like a 6 or a 7 wisdom. Just no common sense at all. Yeah. So that's why I don't listen to a single fucking thing any of these anecdotes are. Because I know that the people that are giving me the data, they don't have what it takes to even record data most of the time.
Oh, man.
Yeah, I'm not trying to win a popularity contest.
I know.
I just tell the truth. It's like, there's nicer people than me.
You and I also just speak a little bit differently because I like to...
You're charming.
It's hard for me to say everybody does because I know there's always somebody that doesn't, you know?
Right, but I don't play the outlier game. I shoot right up the middle. If 95% of people do a certain way, then that's the way people do it. And there's 5%, 2.5% over here that do it really wrong, and 2% over here that do it right. I'm not going to give everyone of the benefit of the doubt because 2.5% of people do it right when 95% of people do it wrong.
I don't want to stick on this conversation too long because I know this isn't what the podcast is about. But I think the thing that always irks me about this type of communication. Obviously, communication is important so people can understand where you're coming from and what you're trying to say, is that most people incorrectly interpret, right? And the problem is people will say everybody for the 95%, but will also say everybody for like the 60%. And that's the problem, is you don't know what they're talking about. And that's where it gets into a thing. That's where it's like people start saying shit like all bodybuilders are liars. So is Dr. Todd a liar? Am I a liar? I don't stand with the whole everybody is, you know?
So I don't know if I said every single piece of anecdotal evidence is bullshit. I think what I'm saying is I can't trust anecdotal evidence because most people are not correctly interpreting their data.
Gotcha.
So because it's a correct sample, I throw the whole sample out. Better thing is apples. If at least 20% of the apples are rotten, I'm throwing them all out. I'm not selling any of them.
Gotcha.
That I have zero confidence in that sample because there's a huge percentage, 20%, that are false positives. So I disregard all of it.
Okay. Gotcha.
And I don't care if it's 60%, I don't care if it's 40%, I don't care if it's 30%. It all has to be gone. So here's an example. You got a military force, right? And you know that the 15th Division has some traitors in it. You don't know if it's 10%, it's 20%, it's 40% of them are traitors. But you know that there's a leak coming from the 15th Division. So I'm going to use them as a decoy. Get them all. I'm going to sacrifice all of them while I use the main force to show up and hit from the back. I kill 2 birds with 1 stone. Somebody had to be decoys, and I might as well use the ones that have traitors. Maybe 90% of those men were loyal. Maybe 10% of them were loyal. But I can't trust that division, so I need to eliminate it from my army. So when people come to me and they say, oh man, Masteron makes my joints hurt, then I always make jokes. It's like, oh, Masteron makes a lot of people's pussies dry because they don't drink enough water. And then what it does is the people that get upset, they know they're the ones that aren't 100% confident that they're right. So they're the ones who clap back. And then the ones who are like, that's pretty funny. A lot of guys are full of shit, but I know for sure I'm hydrated and my joint's still dry. And they don't comment. They're the ones who have the confidence because they know they're right. It's the people that don't have confidence that want to argue, especially screaming into the void in a comment section. So when I've heard so many dumb motherfuckers tell me that Masteron makes their joints dry, that I just ignore it altogether. Now, I've had one person who was super diligent, who had measured his skin. He went on Masteron for a certain amount of time. His skin was really dry. And then he went off of Masteron and then checked it again, and his skin was no longer dry. So he did a crossover controlled study with himself. And maybe the positive predictive value for the rest of the population is irrelevant because the sample size is one. Mm-hmm. But for him, it's 100% valid. Masteron really does make his skin dry. Mm-hmm. And I respect him because he did it right. Mm-hmm. But I'm not going to assume everyone else does it right because he did it right.
Yeah.
So I have to assume everyone's wrong unless they can prove they're right.
I've been training for over 15 years now, and I was too lazy to track anything training-wise for about the first 10 years because science-based training is for pussies. But I kept hitting plateaus from burnout, fatigue, joint issues, and injuries, and other factors that at the time I didn't really fully understand, realizing not everyone is built to handle the intense and same workload and injury resilience as Tom Platz and Ronnie Coleman, sad face. I wanted to speed run that shit, but the reality is dudes that have always known their body best are the ones that have been lifting for at least a decade. Shit takes a long ass time to figure out. I started tracking all my training on the Notes app on iPhone because I don't know what paper is. Until recently, I started using the RP Hypertrophy app. The RP Hypertrophy app spoon feeds you step-by-step workouts tailored towards whatever your focus is, or you can customize the workout yourself. Well-educated coaches have always cost $250 to $500 or more a month. I'm paying $500. That's like 10 bottles of testosterone. But if you're not competing or you don't have the money to spend, the app will adjust your program for you every week to maximize your long-term growth. It'll base this on your pump, how fatigued you feel, how your joints feel, and more. It takes in everything to account. None of which I took into account in college because the only accounting I did was counting how many dumpies were in my class. Look, there's a titty. If you don't believe in science-based training, you don't got to do no 3 RIR shit. You can just hoist heavy steel and track it, because we all know that the people who say that they remember their weights, sets, and reps every week are full of shit. IMO, there's a sort of middle ground where you track your progress and make sure all the variables are right in your food, sleep, gear, progressive overload, and then you go to the gym and slam those heavy PRs until your blood pressure is higher than Miley Cyrus. If you're still unsure, they've got a 30-day money-back guarantee, so if you still don't like it and it gives you a bad tan, you can get your money back. That way, when you compete at your next show, your tan doesn't cost you the first place that you so well deserve. So go to the link in the description below, or you go to rpstrength.com/Nile and use code Nile at checkout. That's rpstrength.com/Nile, code Nile at checkout. Do you happen to utilize any ancillaries to make sure that you're maintaining a decently, sufficient level of health and inflammation in your body?
Probably. I take like 40 or 50 things a day. Like, give me some examples.
Well, I guess even though there's a fuck ton, right? I think it's always nice to just go through the entire list for people to hear again.
Okay.
I have a whole list myself, but it's just always, I think, it helps.
All right.
And there's always new people to come into.
I'm going to forget a lot of shit. So just because I don't include it in the list doesn't mean I don't like it.
Uh-huh.
Omega-3s, 4 grams of DHEA a day, 2 grams of EPA a day.
Yeah.
That's probably one of the most valuable things you can take.
Totally agree with
citrus bergamot for heart health. Tudka. I don't really know if Tudka is effective for liver, but IV glutathione is for sure. I take antihistamines. I take a DAO inhibitor and loratadine and cytidine to control histamine levels, because the anabolics are going to drive up histamine to some degree. Trying to go through vitamin D3, vitamin K2 to protect you from the D3, calcium, vitamin E. I don't take a B supplement because I eat a lot of meat. Vitamin A, I have a lot of carrots, so I don't necessarily add in vitamin A. I take magnesium, 800 milligrams of magnesium bisglycinate at bedtime to get my magnesium in and help me sleep. Take zinc as well. Stinging nettle, pygneum or something like that. Saw palmetto to control DHT. I also use topical dutasteride, RU48841, and isotretinoin and a couple other things on my topical with a derma roller to preserve as much as hair as possible.
I do the microneedling too.
Yeah. Calcium before bed, because not in the morning, because I don't want to interfere with my T4. I take prophylactic T4 to protect against having T3 toxicity if I was to add in T3. I'm in prep right now, so T3 is on board, SLU is on board, MOTS-C is on board, L-carnitine is on board, Clen is on board, T2 is on board. Wrath was a little too strong for me, so I had to, even though it's mine and I designed it, I don't handle stimulants well, and there's very little in it. It's 22 milligrams per caffeine per capsule, but I just don't take caffeine as a general rule. And I have a topical yohimbine cream I developed that I used to sell, but I don't sell it anymore because people were eating it. So, people think I'm hyperbolic when I say people are retards. I get the sample I'm presented with are the world's dumbest people. So it's like the bodybuilding equivalent of eating Tide Pods or injecting Lysol is eating the topical fat burner cream. And that's what I have to deal with. So that's my perception of mankind. So you invent something that can help everyone and you can't sell it anymore because 1% is so dumb that they're so dangerous that, when I made D2 liquid, everyone was drinking it from the bottle. They weren't using the oral syringe that came with it. And it was making their thyroid stop working. I'm like, well, this is a lawsuit waiting to happen. I'm not going to make this anymore. So no one ever sued me because I stopped making it. It didn't matter how much money I was making. I'm not going to burn out people's. It's like goldfish. You just keep feeding them and they'll eat until they die. So it's like you can't just give them something that burns fat that they can stick in their mouth because they'll just keep sticking in their mouth as long as they look in the mirror and see fat until they're dead. It's so scary to be and you're like, well, that's so cynical. It's like, but if you're the one who's legally on the hook for them self-destructing,
right,
you can't risk it. Mm-hmm. So because that's what I deal with, that's my perception of mankind. People save things. So there's things people know not to say out loud, but they will say them when they ask questions in private. So I have a different stuff that they won't even ask in the comments section. Mm-hmm. So I have a different perception of what's going on. And that's why it seems that I'm so cynical and I'm so rigorous about bumper padding and for everything. Like the helicopter moms that give their kids a helmet and knee pads and wrist pads and elbow pads and ankle pads to ride a skateboard on the driveway. I wasn't like that. I didn't need that. But after doing medicine, now I realize that's why those things exist. Mm-hmm. Is there are people that need those.
Mm-hmm. And sometimes you don't know.
And so if you're the guy who makes the skateboard, you have to make it a law that if you're going to ride the skateboard, you have to have all these pads on. Mm-hmm. So those are like some of the ones that I use. That's not all of it.
Right. Yeah, there's a fuck ton.
For prophylactic, Telmisartan and Retatrutide. I really think those are very protective.
Okay. Yeah. What do you think about, I want to ask about Retatrutide in a second, but what do you think about MOTS-C and SLU and how do you feel like that's worked for you?
Energy and heat. That SLU, without MOTS-C, prep is a nightmare. With MOTS-C, especially with MOTS-C and SLU, mm-hmm. prep's so much easier.
Nice.
Same thing with Retatrutide. They all work so well together.
What about methylene blue? Have you tried that?
No, because Ella, Scientific Snitch, says that it's a DNA chelating agent. So it's going to cause massive DNA damage and rampantly increase the risk of cancer. People are afraid about using GH because GH causes cancer. GH doesn't cause cancer. It causes IGF-1 to go up, and IGF-1 grows everything,
right?
Muscle and cancer alike. But eating protein increases IGF-1. Lifting weights increases IGF-1. So everything you do to grow muscle also would grow cancer. That's not the same thing as an actual direct carcinogen. Methylene blue isn't a direct carcinogen. It will create cancer.
I'm so curious how true this is. I haven't done any research on that. It's my fault.
I mean, Ella did the research. I didn't do it myself.
Uh-huh.
but it's used in labs to chelate the DNA. Specifically, it's also goes around mitochondria. It targets the mitochondria DNA for this, and the mitochondria DNA is even more fragile because normally when the DNA is wrapped around histone cores, it's protected. It has to be open and ready for transcription to get actually broken up and damaged by carcinogens. So only cells that replicate get cancer, really, which isn't entirely true, but your chance of getting skin cancer is way higher than your chance of getting a neuronal cancer because neurons don't replicate and skin does. Mitochondria have a much more vulnerable DNA. I think there's the mitochondrial DNA has less histone core, or it's in a transcription available state more often so that there's more opportunity.
Okay.
I think it also gets in the way of the CD4 or CD1 and 2, which are basically anti-cancer checkpoints.
I'm curious what Dr. Scott Scher would say about this. I'm kind of I have a feeling that it's this was one of the things that were very dose dependent, where I think the doses below probably 5 milligrams, maybe 10 to 15 milligrams are significantly lower than the doses applied in this study. But I mean, this is something that I feel like I would have to look at myself, and I'm kind of just throwing shit out. So, but that's good to know. Damn. What about Retatrutide?
I love Reta. So Reta, I never used Ozempic and I never used Tirzepatide. But Reta in the beginning of prep, it just took away all hunger. I just didn't care. I'm still very food focused now. Once I got lean enough, it's just, I don't think it matters. I think it's different mechanisms that are in play. Maybe Reta's helping. I'm only using 2 milligrams twice a week. And I know I could use up to 12. I probably should up the dose again to 3 milligrams twice a week.
How do you feel on it right now, I guess?
I feel fine.
Yeah, you don't feel any, there's definitely like no nausea or anything at this dose.
I've never had any nausea.
And how much do you inject it right now?
On a high day, at the end of the high day, I use 2 milligrams.
Okay. And then
I have 2 high days. Well,
two high days.
2 medium days. I have 2 3,000 calorie days. And my normal days are 2,000 calories. And I've been like that for since 16 weeks out. Whereas normally I'd be at 200 carbs the last couple weeks before a show. I've been under 200 carbs from 16 weeks out. So for 8 weeks, this is the longest, most brutal diet I've ever done.
Yeah.
And I feel nothing compared to what I would normally feel because of Reta.
That's awesome.
And then the energy I get from the MOTS-C and the SLU, the combination of those three, not that that's all I'm taking, but that's the 3 new things this prep that I've never done before. And out of 17 years of competing, this is by far the easiest prep I've ever done and the leanest I've ever been. 15 weeks out, 12 weeks out, 11 weeks out.
How many weeks out are you now?
I'm 8.
Yeah, your arms look pretty fucking lean.
I was down to 184 this morning.
Do you remember, what was your last stage weight? Do you remember?
Well, I got down to 177, but I fucked up my peak, and so I was on stage at 191.
Oh, shit.
I looked my best at 184. So I don't look good today, but I looked really good Saturday morning.
Okay.
Saturday morning, I was 187, and I was blasting full, vascular striations everywhere.
Nice.
The only thing that's not in is my glutes, but with classic, your glutes are covered up by the trunks anyway.
Yeah. Your diet sounds kind of similar to mine. Also have the carrots. Also got 2,000 calories about for a base, and my high days are higher than yours. They're about 3,400, 3,500. And I have been considering starting Reta. I wanted to try Tirzepatide first to see how that is, and then go Reta just because I want to, just out of curiosity.
But what? Why would you rob a bank with a knife when you could rob it with a gun?
So I think the first thing is I've read some anecdotes of people that just have to titrate the dose up higher and higher. And I know I'm probably not going to ever run into that problem for as long as my prep is and how long the next following shows are. But I have Tirzepatide on hand. anyways from
Okay,
Transcend.
that's a different story.
Yeah,
If
they sent
you-
it to me anyways. So
If you have if you have tirzepatide on hand, then you could use that. But my understanding is it's a lot cruder.
hmm
It's just less sophisticated.
I know of some differences, but what are the differences?
Well, there's no glucagon in the tirzepatide. There
Yeah.
is glucagon in retatrutide.
Right.
So I had a 136 average blood glucose on
Mhm.
50 units of insulin. I used 1 milligram of Retta, and the next day I didn't use insulin, and my average glucose was 96. Within a month of using Retta, my average glucose was like 70.
Nice.
It completely cured my diabetes.
Damn.
And
Fuck.
if I didn't have that, I would have went hypo. I've never went hypo since going on Retta.
That's
because
fucking
of the glucagon.
sick. Yeah.
I never run
Yeah.
out of energy.
I'm a big fan of how much it regulates blood sugar. Yeah, that's probably my favorite part about it, to be honest.
It's the only reason why I added it in. I didn't add it in for hunger.
I think one of the concerns I didn't mention that I had, and I know the percentage is extremely fucking small, but I tend to be one of the percentages that has insomnia. You know, like I
Mhm.
have this random insomnia, and it's been the worst and annoying thing, and I've had to pay a lot of money just to get like mouthpieces for sleep and all this shit. So I'm a little bit more, I guess, I don't know if it's neurotic when it comes to sleep. So I think my one concern is that there is like the smallest percentage increase in heart rate and sleep disturbances from Retta versus tirzepatide. And that's kind of why I wanted to try both, is to see if I have any of those issues for
I have
either.
a 73 resting heart rate. So
And that's on a Diet Coke, right?
that's on the Diet Coke. It's like 73 heart rate. It's like 60 or 50 when I'm sleeping.
All right.
When I train,
we're-
it gets up to 100, 110
Mhm.
with weights. Cardio, it's usually like 100.
Mhm.
So
Let's do this Q&A real quick because we have like 5 minutes.
that flew by.
I know, bro. It's the problem with these. That's why my podcasts have been going 3 hours long recently. KST Mario says goth girls or PEDs.
Goth girls.
Polly fucking D asks favorite Final Fantasy character and why.
Sephiroth.
Sephiroth.
Yeah.
Thought you were for the good, bro.
No.
National White Fitness asks if Masteron was a woman, would you marry it?
Yeah.
Yeah, for sure.
Yeah. Absolutely.
Um,
Masteron doesn't say no.
Hayden Sandquist asks, would Masteron E cause less metabolites than P? I'm assuming he says Primo. Hence why people go bald from P.
It's not less metabolites, but the metabolite from Primo is the AI. And whenever you stop aromatase, you're going to drive the flow towards 5-alpha reductase. You're going to get more DHT out of the test. If a cup has 2 holes and you plug one of the holes, the flow out the other hole is going to speed up.
This is whatever. I'll ask it anyways. The real Meoff asks recommended dosing for a test mass Anavar stack. This is definitely going to depend per person.
Yeah, it's
greatly.
like 20 to 40 milligrams of test a day, probably 25 milligrams of Anavar pre-lift sublingual, and all the rest of your gear load should come from mast, whatever that needs to be.
Okay. I know this is kind of something you've discussed a fuck ton, but Yoseba is an awesome dude, and he's a fan of this pod and RBP. And he asks, what reason do you prefer mast over other PEDs like Primo or NPP?
Primo's an AI, and it's weak as fuck. It's 60 to 80% the transcription of testosterone, whereas mast is 80 to 120% the transcription of testosterone. So transcription of DNA into protein, which is what you're looking for, is how much protein are you getting milligram per milligram. And then NPP, that's about 60 to 70%. So basically mast can be up to twice as strong as Primo and Nandrolone and has almost no side effects at all. With the amount of drugs, with the amount of Primo you'd have to take to be equivalent to Masteron, it would drive up the DHT conversion from your test so high that that extra DHT would cause the HDL suppression that the Masteron causes anyway. And then because the Nandrolones have a progestational effect, it causes gyno in most people. If you've got no nipples, fuck it, rock the Nandrolone. But in most people, there's going to have some real consequences from using nandrolone.
Yay, Peter Yanowski asks, nothing to ask that y'all won't already be discussing. Very excited about this collab, though.
Oh, cool.
Yay. Christine Santino asks, how do you rotate your injection sites when doing daily injections?
Middle delt, rear delt, lateral tricep.
I love the rear delt.
Long-headed tricep. That's 4 sites on one
Tricep.
arm. Oh, yeah.
Whoa.
4 sets on one arm, 4 sites on one arm, 4 sites on the other arm. So you got 8 sites. If you want to, you can use lats. I never do quads.
Yeah. Just want to say this for the pod, but I believe that everyone has different sites that are best for them. Like you hear some people that just can't inject their lats and they get nerve damage. Some people can inject their lats fine. I've been able to inject my lats for a while fine. Some people don't inject their glutes and they have issues with maintaining their striations. Some people don't have that problem. Yeah, I think you just got to kind of figure it out for yourself. Restless 1982 asks BP meds if telmisartan doesn't get the job done.
I think you got to fix the real problem. Why do you have high blood pressure? It's probably because you're using too much test.
Yeah.
It's a cycle design. If you don't have blood pressure problems when you're off cycle and you do when you're on cycle, then the problem's your cycle, not finding the right med.
Cycle. Yeah, cycle and lifestyle, I would say.
Right. Well, I mean, if they're eating chili cheese fries and Big Macs, then that's probably going to be the problem.
Not doing cardio or anything too. Yeah. Negative Jack asks, when getting blood work, what should you do before to get accurate results?
Drink a gallon of water.
My bro told me this today.
Yeah. Gallon of water.
Also, I think it would be best for someone to take at least 4 days off of training, but nobody.
Well, if you do that, that just gives you a false low on your ALT, AST. It's not like you're going to, like, oh, you've got kidney disease, and then you just stop lifting for 4 days and get it redone. Like, your kidney disease is cured. No, it wasn't kidney disease. You were just lifting. So that's why you'd order cystatin C for kidneys and GGT for liver. They're not based off training.
Connor Logan asks, how have you brought up your back so much, especially so deep into your career?
I don't know. I had Niall show me last year how to train back.
Come on, spill the other truths, bro.
All right, so I wasted about 2 years trying to do the optimal training and the slow shit, and that's how I lost the back.
Really?
Yeah. So when I just took the good from the optimal and went back, so the exercise selection I was using, which was bent rows, pull-ups, one arm dumbbell rows, and rack pulls, that was the wrong exercises.
Rack pulls was wrong.
Yeah, but what I did do is I used the chest supported rows and one arm lat pull downs, but I used the same level of intensity. And basically, Dom Kuza went with me to the gym at 17 weeks out and was like, take the belt off while you're training your lats. Because I'd never wore a belt when I was training my lats before, and I did that season and my lats disappeared. And then also, your lats are contracting better when you do it your way and not the optimal way. So I was always able to make a mind-muscle connection with my lats if I just stretch the lat and squeeze the lat, not worrying about the cueing and all the rules that the optimal training people said. But the optimal training stuff is just a bunch of cues that are not helpful. If you actually can feel the lat, just stretch the lat, squeeze the lat.
Gotcha.
So I just don't pay attention to what I'm supposed to be doing. I pay attention to what I can feel. You know, because the optimal crowd says like for instance, Kuba Celian says, it doesn't matter if you can feel the muscle, just execute the proper form and the muscle will contract. Which might be true, but it's not good enough for me. I want to be able to feel the muscle, stretch and contract, and then escalate up load as needed to stay in my rep range. So for my lats, I'm doing something stupid like 12 to 17 reps with one arm rows and shit like that with cables. And I feel the lat where I want to feel it, even though it's pathetically low weight. And I think that the lats have really improved a lot in the last 3-4 months.
I'm on the team that if you're experienced enough and you feel it doing it a certain way, and then you see the results, that's the way to do it for you, obviously. Yeah.
So mind-muscle connection, taking it near, if not to failure, and making sure to train it 3 times a week.
Lethamal98 says, I'm curious on his stance on someone with cystic fibrosis getting into bodybuilding.
That's brutal.
Hmm.
I don't have much of a stance about that. That's really bad lung, like scarring in the lungs, fibrous lungs, and you can't breathe very well. It's a really poor prognosis, very sad disease to have. I don't know how that would really play into it, except for I'd assume take really long rest periods.
Uh-huh.
But there might be something he's talking about that I haven't considered, like if the collagen synthesis generated from anabolics and all the other drugs we use to heal would probably exacerbate or accelerate the rate of cystic fibrosis. I'd have to really do some digging before I had an intelligent answer. All I can say is I don't have a good intelligent answer for this.
Right. We're playing, we're really just like playing programmer with ourselves. It's like every small thing will affect something else. So if you have genetics that are predisposed for certain diseases, man, it makes things a lot more complicated. It makes risks for certain things so much higher. And I think a lot of people don't know that because not everyone's in the medical field, you know? So that's why we're seeing a lot of these accidents happen. I'm thinking, you know, because obviously I've had a death recently. I'm just thinking about all the people in my life that have died recently. And obviously a lot of them are not bodybuilders, but so much of it, especially when it's like a random occurrence. It's just, I don't know.
Would you agree that, you know, like the relative risk of sudden death for health-related causes is higher in the general population than bodybuilders, not higher in bodybuilders, even though the perception of the public is that bodybuilders are less healthy and more likely to die.
Is that fact? Or is that?
Well, I'm asking you. Because
do I believe that?
You know a lot of bodybuilders and you know people that aren't bodybuilders, but the majority of the people that you know that died weren't bodybuilders.
Yeah.
So it isn't a risk enhancer to be a bodybuilder. And I think it's a risk decreaser. You're less likely to die if you're a bodybuilder.
I'm on the stance that there is no correlation, and what is important is how adherent you are to monitoring your own health. And some bodybuilders are super adherent, and bodybuilding sometimes pushes people like me to be more obsessive over health and learn more about medicine and all these things. On the other side, there's the opposite too. You know, there's people like Boston Lloyd, you know. So,
but the problem is Boston Lloyd's the exception. But because he's the exception,
he's the extreme.
He gets the most attention, and people who don't really have any wisdom misperceive this exception as
I don't think
rule.
he's an exception. I think he's an extreme. He's like the extreme end of the polarization. There's people all in between, you know.
But I would think that 1 out of 1,000 bodybuilders wears bad judgment as Boston Lloyd, whereas people think it's 50%.
I mean, you think a lot of people are retarded, right? So
yes,
there could be a big percentage there.
But retardation is scaling.
I'm sorry for saying that word, by the way, guys.
I love the word. It's my favorite word. No and retard are my 2 favorite words. So I would say that
we're not targeting any specific demographic or anything.
No, it's just it's anyone who's 2 standard deviations lower than you is going to appear retarded because it's relative. That the definition of retard is someone who's 2 standard deviations below the average IQ.
All right. Change the conversation. I'm not part of this conversation right now. There's something I really like that we discussed though before we wrap up. The frequency training, the high frequency training, and how we're talking about like optimal based and science based and all these things. I think it's kind of, I've been talking about this a lot. I also talked about this with Dr. Pat Davidson, who's a really cool guy. I don't know if you know of him. He's like on the Men's Health magazine, like podcast all the time, and just cool guy on training. And he, you know, being a science dude also is just like, yeah, these optimal TikToks and people have taken it way too far, right? Like there's a level of fucking oomph that you have to get your body to adapt. And I think while everybody should find the frequency, the training program, the periodization that's best for them, I think there is kind of something to be said about 2 of the best classic bodybuilders we got right now, Mike Summerfield and Terrence Ruffin, did implement high frequency training and different forms of upper lower splits into their program when they gain the most mass. So I think that's kind of cool. There's a fuck ton of other variables in there too, such as gear.
They're doing upper lower off is when they made the progress. I've been doing upper lower off. So I just didn't need the rest.
Mm-hmm. I think the higher frequency does make it a lot easier for you to not only like reach the I guess the most optimal volume for stimulating your own hypertrophy, but the whole thing of just being able to do like, you know, like it just fresh this 6 sets, fresh this 6 sets, this fresh this 6 sets versus like a total of like 18 sets in one thing, right, where all the other sets aren't as fresh, you're not doing as much load, etc. You know what I mean? Right. So that's the thing I like about training frequency, but it depends on your lifestyle. I have one last question I ask everyone at the end of every podcast, which you've answered once before, but if you were to disappear from the world tomorrow and you had one message you could send to the entire world today, what would that message be?
Get really into Warhammer 40K books. That is so fucking cool. And you will never hit bottom. That is the deepest, most elaborate story ever told. Like the Horus Heresy alone is 63 books. That's just one war. That's from 31,000 to 31,200. And that means that there's 9,000 more years of war between 31 and 40.
Holy shit.
There's such an elaborate fucking universe.
That's crazy.
Yeah. If you're like in a wheelchair or you're quadriplegic tomorrow, I know that that sounds horrible, but upside, you get an infinite amount of audiobooks to listen to, and Warhammer 40K, you'll never get bored.
Oh my gosh. That probably was the deepest answer that I've ever had to that question ever.
That started off silly. It sounded silly, but it was deep.
All right. Where can everybody find you, bro?
So Google Todd Lee MD, and I'm on every platform at Todd Lee MD, with the exception of YouTube, which is Dr. Todd Lee's Anabolic University. Gotcha.
Awesome. And coaching-wise, where can they find you? If they
ToddLeeMD.com.
Cool.
If you want to reach me, get a consult. I only talk on the phone. I never text. I never email. It's all got to be voice. Because the only way to really communicate with someone, especially about something as personal as health, is at least on the phone. Because it's really hard to develop a relationship with someone about their bodies and health and their mind with text. Text is 8% of communication. Verbal is at least 18 to 20%. Mm-hmm. So body language is, I think, somewhere up to 70%.
Yeah.
So you get so much better connection with clients and patients on the phone than you ever would with email or text.
Totally agree.
Plus, it's a huge HIPAA violation to ever communicate with patients on HIPAA or email.
Okay, gotcha. Awesome. Thanks for coming on, bro.
My pleasure, man. Thanks for having me.
The most savage and polarizing doctor I've ever spoken with in my entire life.
And to me, I'm being tame. This is me tame.
All right. Peace.